Member for West Vancouver Capilano.
Mr. Speaker, British Columbians have done and are doing their part to fight COVID-19. They have overwhelmingly got vaccinated and boosted, and now they want government to do their part too. People are asking for clarity, Mr. Speaker, in how British Columbia is moving forwards to an endemic approach to managing COVID-19. But so far, we are yet to see clear, specific metrics, targets, or timelines for lifting the remaining restrictions. So the question to the Premier is, can he tell us the specific metrics for lifting the remaining COVID-19 restrictions?
Minister of Health.
Honourable Speaker, with respect to the specific restrictions put in place to deal with the Omicron variant of concern, when those were extended in the early part of January, Dr. Henry was specific as to when they would be reviewed. She repeated that statement on a number of occasions in between time, as did I. And on the day where we said we would respond, we did. And changes were made to ease restrictions. When that announcement was made, specific dates were given as well as to when the remaining restrictions would be considered. We're following that schedule precisely. We're continuing to follow the advice of public health. And I think it's that clarity that has allowed us to keep schools open where other jurisdictions have not. And I think, Honourable Speaker, to work very closely. I'm very proud of the work public health has done with the business community, with the labour community, with the nonprofit community, with those who work with people with developmental disabilities, with school communities, and with many others about COVID restrictions and their impact. So we've been clear, precise, to the day, and we will continue to be.
Member for West Vancouver Capilano, supplemental.
Thank you, Mr. Speaker. British Columbians are left wondering what reviewed means. They're wondering what being considered means. So BC is an outlier when it comes to a clear and transparent, specific plan for lifting COVID-19 restrictions. British Columbians have followed the rules to fight this virus, so it's only fair to ask for clear, specific metrics when it comes to lifting restrictions. In fact, just last year, the BC Restart Plan had targets for hospitalizations, case counts, and vaccination rates. It makes no sense that we don't have that same level of transparency today. Surely there are specific indicators that will be used to make these decisions. So again, to the Premier, what specifically are the clear scientific metrics for how the remaining COVID-19 restrictions will be lifted?
Minister of Health.
Honourable Speaker, every day we provide specific metrics on how COVID-19 is going in British Columbia. The member will know that yesterday we saw two things. We saw the number of people in hospital, I think it was 516 yesterday, and that is less than half than it was at the height of the Omicron variant of concern pandemic, which was 1,058. However, it's also higher than it was at any time in the pandemic prior to December 1st. So this is continuing to be a situation that's particularly challenging for healthcare workers everywhere in BC. It's why we've taken a balanced approach as we have from the beginning. Other jurisdictions have moved their restrictions up and down more quickly, and clearly, and it's true, other jurisdictions have relied less clearly on public health than we have. But the situation continues to be a serious one, and it's why a balanced approach is required. It's why on the day that Dr. Henry said she would address the lifting of restrictions, she did. She gave 4 weeks notice of that, repeatedly updated it, gave a clear plan with clear metrics as to why that was happening, laid it out remarkably, including yesterday. She also, at that time, gave specific dates. I don't know how you can be more specific than giving specific dates as to where the existing restrictions would be reconsidered. So the information is clear, the evidence is clear, the challenge continues, and the balanced approach remains. And I don't know, Honourable Speaker, of any jurisdiction in North America that can be prouder of public health than British Columbia.